Nipah virus disease or infection is caused by Nipah virus. Nipah virus belongs to the genus, not family, Paramyxoviridae, or it is a kind of Henipavirus. So, as like other Paramyxoviridae family viruses, which causes the normal influenza-like symptom or cough, cold. So, similarly, here also you will see the symptoms like respiratory distress in animals as well as in human, and same time it also causes the very important symptom or very severe form of the Nipah virus disease, the encephalitis. So two symptoms are very important. First one is respiratory distress, and second one is causes the it causes the encephalitis. So here, as you can see, the case fatality rate is also very high, and in some strain, mainly the strain of Nipah virus, which is present in India and Bangladesh, that can also transmit from one person to another person in hospital settings, or the person who is involved in the take care of patients or relatives or healthcare settings like in nurses. It can transmit the infection from patient to other person. So here this disease was first isolated, recognized in Malaysia, but the next after the disease was first recognized in 1999 in Malaysia, and thereafter in 2001 it is noticed in Bangladesh. So and that period, the variant, the virus which was isolated from Bangladesh was different, means somewhat different from which they have discovered in the Malaysia. So here they have reported human to human transmission. So here this is very dangerous, you can say. So as the name of the disease is Nipah, or virus name is Nipah, is based on one village which is present in the Malaysia, that is Sungai Nipah. Based on that a place of origin, that virus is named as the Nipah virus. So you'll see this virus belongs to the family Paramyxoviridae, and the genus is the Henipa virus. This virus, the natural host for this virus is, or reservoir, you can say, is the food bat. Food bat are the natural host or reservoir, and the main cause for the human infection is pig as well as the bat. First one is in domestic animal. You consider the pig is the most important source for the human infection, and in countries like Bangladesh or in India also, India in mainly West Bengal, they are more prone to Nipah virus infection because they used to drink date palm sap. So in that we'll see later how it is transmitted from bat to human. In that you will see the date palm sap is the mainly raw date palm sap consumption is the main cause of the infection from bat to human, and other route may be from the contact with the infected bat, or mainly the bat is the reservoir. So and second one is through the contact with the infected pigs, or directly contact with the secretion or excretion of the pig. So the two main source or host in animal host is first one is the reservoir is pig, sorry, bat, and host is the pig. So this is the etiology and host strain of the Nipah virus. Okay, I forgot to discuss this. No? Nipah virus was first recognized in 1999 in Malaysia, where they found the illness in the pig farmers. Okay, first means instead of animal cases, they have recognized first human case, and who was the pig farmer. Thereafter, in 300 human cases, as well as the 100 deaths were also reported in that outbreak. And similarly, many pigs are mildly infected with the disease. And later, more than if thereafter the people recognize that the main source may be the pigs. In that case, they have euthanized millions of the pig in that area. And thereafter, in 2001, outbreak recorded in the Bangladesh. And here also they have recorded the outbreak in the human. And as I told you, that strain, which is somewhat different when they have sequenced the virus, isolated virus, the sequence they found that that strain is somewhat different from the Malaysian strain or outbreak which have occurred in 1999. So here they have reported the person-to-person outbreak, and in India also in Siliguri, they have reported the person-to-person transmission or means this is very important nosocomial uh, infection. Okay, so in Bangladesh, in endemic areas, outbreak of the Nipah virus is seasonal because it depends on the season where people used to consume that raw dead palm sap. So in that way, it is related. The in Bangladesh, the outbreak is somewhat seasonal, or you can say in that part is endemic. Outbreak of the Nipah virus is endemic. So already we discussed how it is transmitted. So you can categorize the main source is the bat, or directly you can get infection from the pigs also. So first one is direct contact with the infected bat either, or their excretion or secretions. Second, similarly in case of pigs also, direct contact with the pigs or their excretion or secretion means infected pigs, directly contact with the infected pigs. Second is the if you are consuming the food which is contaminated with the excreta or feces or saliva of the bat is another source for the human. So this is the second route or mode. Or third one may be the aerosol route. If you are in close contact with the pigs or in the bat, that virus which is present in the excretion and secretion, it may be aerosolized, and by which the through the air you can get the infection. So these are the main route, and in India and Bangladesh, this is also transmitted from the one person infected person to another infected person. So these are the various route how it is transmitted from bats or from pigs to the human, and also from human to human during the in the hospital settings. So this is the how it is transmitted. And recently, in 2018, the Nipah virus cases was also recorded in Kerala in India. So this is the recent outbreak, other than this West Bengal or Bangladesh. Bangladesh means near to India. In India, we have recorded recently the case of Nipah virus in Kerala. Okay. So, what are the signs and symptoms? You can see just like other viral infection. Initially, it will shows the some febrile type of symptom like fever, headache, or vomiting. So such type of symptom is there, hallucination or blurred vision. These are the all common symptoms you will observe just like other viral infection. And incubation period is also similar with the other viral infection, like 5 to 14 days or 4 to 14 days. So this type initially you will observe some common symptoms other viral infections. And later on, you will observe some respiratory distress, respiratory symptoms, and some neurological symptoms like confusion, mental confusion. And very important symptoms we will observe is encephalitis later on. In severe cases, you will observe symptoms of encephalitis. So you can categorize mainly this viral infection into first one, it will show the respiratory distress, and in more severe cases, it causes the encephalitis. And the case fatality rate is also very high in untreated cases because just like other viral infection, it is also not having any specific treatment or also the vaccine. So only we have to go for the supportive care or the symptomatic treatment. So the treatment is very important, and timely treatment is very important in Nipah virus infection. So here also one point is there that symptoms may be sometimes asymptomatic, means the symptom person may be infected, but it will not show any symptoms. So varies from asymptomatic to more severe infection like encephalitis. So this is all the symptoms. Similarly, there is some respiratory distress type of symptom, runny nose. You'll also observe in pig, in animals. Mainly, the pig is infected. Is not ever mentioned that other animal or domestic animal is infected or not. So the main animal which is infected with the Nipah virus is the pig. Main source is also the pig. So it also shows some common symptoms which belongs to the paramyxoviridae. So it shows the respiratory distress in pigs also. Now you'll see how we can diagnose. So as there is no specific symptom is there, similar with the other viral diseases. So somewhat diagnosis is difficult, as means if any disease is showing peculiar symptoms, you uh, can observe the symptoms, and uh, some lesions you can observe, some pathognomic lesion, then you can conclude. But in many of the viral diseases, this is quite difficult. So diagnosis requires some more specific test. Like we can go for the isolation, or just like in COVID, you can go for the RT-PCR. You can take the swabs of the nasal swab, or you can collect the food samples. Means any type, means in human, through human you can collect the nasal swab, or throat swab, by which or you can take the blood. Anyhow, in any excretion or secretion the virus is present, then you can go for the RT-PCR. Okay. And this is the initially you can do by using using samples, or you can go for the virus isolation by using different cell cultures. So these are the tests we can go for the initial symptoms, after initial symptoms. Later on, after recovery, if you are want to diagnose the disease, you can use the various serological tests like ELISA to determine the how level, or you can go for the serosurveillance. For that, you can go for the serological tests like ELISA. So these are some technique by which you can diagnose the disease. It is quite difficult to diagnose initially without specific test. Okay. So treatment, there is no specific treatment as like other diseases. So you can go for the supportive treatment or symptomatic treatment, but some drugs like ribavirin, that is antiviral drug, is found effective against the virus in vitro conditions. So you can try this drug, antiviral drug. And sometimes remdesivir is also effective against, in some cases they have found in non-human primates, the studies are going on. So they found that remdesivir is also effective against the virus. So you can go for the passive immunization. You can give the antibodies to the monoclonal antibody to the patient. So this is also under trial, and this is all means also we have to give the supportive treatment to the human patients. Okay. Precaution, how, or prevention, you can already we know the how it is transmitted. So the main source is the bat or the pigs. So we have to take care while handling the infected pigs during various operations, or when you are entering in the endemic area where the pigs are or few the bats are residing in that area. So we have to take care. in the during the entrance. We have to take care. Second, we have to take care during the handling of the patient, or take care treatment of the patient in healthcare settings, or the person who is caregivers to the family members. So we have to take proper precaution. Means already we know in that COVID era how we can prevent ourselves by using the mask or protective clothes, or gloves. So we have to take all the precaution, and also during the handling of the virus or infective materials in the laboratory, we have to use the biosafety level at level 3, or because it is aerosol, you can go for the BSL level 4. So in that setting, we require to handle the infected material or isolation of the virus. So these are all the precautionary measures you can take during the handling of infected pigs, animals, or the reservoir if you are entering, and during the take care of patients, or your relatives. And one vaccine is there, but this is not worldwide or not for worldwide use. That is subunit vaccine again against G protein, which is prepared against G protein of the virus and web. So this is not actually widely used vaccine. It is now under the, you can say, trial, or it is used in some part of the Australia. So this is the this is not against actually the Nipah, but this is against the Hendra virus. So this is Hanifa and Hendra virus is somewhat related. So this vaccine can be used for the prevention of the Nipah virus. So this is the uh, prevention and other transmission and treatment of the Nipah virus. So this is all about the Nipah virus. This is a very small disease, not will involve any vector. The disease can be directly transmitted from a reservoir or host to the human being, and also from one human to another human. So